Is grief related to medical experiences considered medical trauma? Have you ever wondered if grief tied to medical experiences can be classified as medical trauma? This is a complex question that deserves careful exploration. Medical trauma refers specifically to the psychological and physiological stress reactions that arise from interactions with the medical system. These reactions often occur when there is a real or perceived threat to life or bodily integrity. For example, experiencing a serious illness, undergoing painful procedures, or facing frightening medical events can lead to symptoms similar to post-traumatic stress disorder. These symptoms may include intrusive memories, avoidance of medical care, anxiety, and mood disturbances. On the other hand, grief is a natural emotional response to loss. This loss can involve health, function, or even the death of a loved one due to medical issues. Grief is characterized by a range of feelings, such as sadness, anger, denial, and acceptance. The process of mourning can vary significantly from person to person. While grief itself is not classified as trauma, it can become complicated or prolonged. This means that some individuals may struggle to move through the stages of mourning, which can significantly impair their functioning. In such cases, grief may coexist with or even exacerbate trauma symptoms. When we look at PTSD and medical trauma, the key distinction lies in whether there was a traumatic event that involved a threat or harm. Medical trauma involves events perceived as life-threatening or severely harmful within a healthcare setting. Grief related to medical experiences may accompany medical trauma, but it is fundamentally a separate emotional process focused on loss. Grief connected to medical experiences may indeed be part of the broader psychological impact of medical trauma. However, it is not classified as medical trauma unless it includes specific traumatic stress reactions as defined clinically. Treatment for medical trauma often involves evidence-based therapies, such as cognitive behavioral therapy or prolonged exposure therapy, to address trauma symptoms. In contrast, grief may require supportive counseling or specialized grief therapy. To summarize, medical trauma arises from medical events perceived as life-threatening or severely harmful, leading to trauma symptoms. Grief is an emotional response to loss, including loss related to medical illness or death. While grief related to medical experiences is not inherently classified as medical trauma, it can coexist with or result from medical trauma. Complicated grief is a prolonged and severe form of grief that may require clinical intervention. Both grief and medical trauma can significantly affect mental health, and professional support tailored to individual experiences is often necessary.